Well, welcome everybody to another live Facebook webinar with PALCUS. My name is Angela Simoes, and I'm here with Denise Borges. Hi, Denise. How are you?
Hey, there's the most awesome chairperson in the whole wide,
Oh, right, yeah.
all of the universes, not just ours.
Right. Um, and today, I'm actually really excited about today because it's a topic that, is long overdue, and it's about health disparities and actually, health research within the Portuguese community. And we have Dr. Carlos Pavao here from Georgia State, and he's going to be walking us through some of his research that he's done. And, in the last few years, I think, if you asked people what are some diseases that Portuguese people specifically get, people may know about like St. Joseph's disease, right? But in recent years, there have been a few other conditions that have surfaced that are actually quite common in the Portuguese community, but nobody really knows about them. And if we wanted to do research and what's the data on other conditions, it's just not there. And so Dr. Pavao is here to talk about that. And hopefully this is the beginning of solving that problem. So thank you, Dr. Pavao, for joining us. And if you could give our listeners or our viewers a little bit of background on how you got into all of this. And I'm going to make you host so that you can share your screen as well.
Okay, this is going to be a process. Y'all better just sit back and relax.
And tell us a little bit about yourself and your Portuguese connection, a little bit of that as well. That'd be great.
Sure. All right. Did you make me host?
I did.
Okay, hold on 1 second. Share screen. I have to walk through okay, share screen. Do you see it?
There we go. Yes, perfect.
We sure do. Thank you so much.
One second. Great. Let me take this stuff out of here.
Looks great.
Okay, good. Put it over here. Sorry, y'all. I just have to be I don't like any distractions. So, first of all, I want to thank both Angela and Denise for letting me be here today. Talking about health disparities or public health for me is a very important topic. I have actually been working in public health close to 30 years as a practitioner.
Oh, wow.
And also I started in the Portuguese community and actually in Fall River. So I actually worked for an organization that no longer exists called the Portuguese Youth Culture Organization. So we actually at the time provided healthcare services, actually not really healthcare services, but really social services for the Portuguese, Cape Verdeans, and even Brazilians. So, and actually was started by a priest. So in some ways, when you're thinking about health, it's very, very local. So I've done many different things. I've coordinated coalitions, worked at state level, worked at the national level. I worked at the intersections of HIV, substance abuse, and mental health. But I really want to mitigate the issues that we have between research and practice. So what do I mean by that? There's a lot of research that happens in the academy, in the academy, so to speak, but that doesn't necessarily translate to the community. And there's a lot of wonderful things that happen at the community level that don't necessarily translate to the academic setting. And I'm going to talk a little bit about that later on. So I work at Georgia State. I'm assistant clinical professor there. I'm actually a newbie to academia because I went to get my DRPH or my doctorate late in life. And I really wanted to become a methodologist. So what I mean by that is, since I had the public health experience, I really didn't want to learn about public health. I really wanted to learn more about the methods and how to work with hard to reach populations. And I wasn't really sure where I was going to go with this. I had no plans in going into academia, but I taught 1 or 2 courses and I got the teaching bugs. So here I am now. So I'm actually at Georgia State. It's located in downtown Atlanta. We have a school about 56,000 students, and we're like the largest in the state. We're very, very diverse. And the reason I'm actually at Georgia State is because I've been living in Atlanta before I actually got my doctorate. I'm also affiliate faculty with the Department of Portuguese Studies, actually the Department of Portuguese, yeah, at UMass Dartmouth. So I actually do some work with them. And mainly around, I write a couple columns for 2 newspapers. One is the Portuguese Times, and the other one is the Mundial from Winnipeg, Canada. So that's a little bit about me, but I really don't want to take too much time, but I really want to sort of just dive into what we need to talk about. This project is sort of a baby of mine. And what do I mean by that? It's something that I've been working on for about a year, right? I think about a year. This is a project that's looking at both Brazilians, Cape Verdeans, and also the Portuguese. And looking at what's been published in peer-reviewed literature to date, but also what does this really mean for understanding for the Portuguese-speaking community when it comes to understanding public health. Then all of a sudden, COVID hit. I was quietly working in my corner, doing my little thing, and then all of a sudden with COVID, public health is around us all the time. So I think from one level or another, we're more engaged about the importance of health and also the importance of health systems to ensure our communities are healthy. So we're going to touch on a couple of things. So let me go into the next slide. And some of the things we're going to be looking at is what's been published so far for the Portuguese-American population, and also looking at it from a health equity lens, looking at health data and the outcomes. In other words, what is some of the literature saying around health outcomes? Like, what is it saying about the community? And what does this mean for the future? Which is a really important question to ask, because what's been published can also direct how future research goes, but also can inform practice, meaning community-based organizations, medical and also public health personnel, and how to approach when it comes to the priorities for the community. Another one is, because I am a practitioner at heart, I just don't want to just publish for the sake of publishing, which could be nice in itself, but that doesn't mean anything in the grand scheme of things. I want to look at some of the possible challenges that we have, and what do we do with that? And we're going to end with some what I call like prompting questions, because I really want to get your input on this. So let's go into the, before I go, the slide format is about 11 slides. There's only about 9 slides that I would say that's the heart of it. The rest are just like the intro and the question or my contact information. I should say that out of this book project that I'm looking at the 3 populations, there's 2 papers that are going to be published independent of the book. One is this, and the other one is similar to this approach that we're actually are doing with the Portuguese-American population, is looking at the LGBT community and what's been published around Luso-Brazilians, meaning anyone who's Portuguese speaking, or let's say Portuguese, Cape Verdean, or Brazilian ancestry. And that is a more exciting, for me, paper, because one of the things that we're going to talk about later on is just because you publish, you could indirectly further stigmatize the population. Even though I'm not going to talk about the LGBT, we need to talk about that here for the Portuguese-American population. So going next, I'm trying to go next. So you have to forgive me, I have 2 screens. I'm like going like this. So I don't know who's participating, so I'm not going to assume. If it was, let's say all Portuguese-Americans or Brazilians or whatever, I wouldn't be covering this at all. But just in case, I figured let's just kind of ground us. One of the things that we need to understand is where geographically the Portuguese-Americans are located. So you see here, California, Massachusetts, Rhode Island, New Jersey, they have the highest concentrations, followed by a couple other states from Connecticut to Hawaii. And then other states that have what I call kind of like the middle of the road. They're there, but you don't realize that they're there. And that's literally from Nevada to Texas. When I was in Texas, I think it was my 3rd or 4th year. Oh, actually, no, yeah, 3rd year. There is a Portuguese group in Texas that they meet. I never participated because I was too busy studying. And then there's also, unbeknownst to me, I finally connected with this gentleman. There's a lot of work with Portugal and University of Texas in Austin around biomedical technology. And this, I can't think of his name off the top of my head, that we had good conversations about how do we do possibly some collaborative work in the future.
Is that Dr. Perry?
No. This is, his name is Mario. So Portugal has invested in Carnegie Mellon, University of Texas, and MIT to have Portuguese scholars learn from our like biomedical experts and how to literally advance their biomedical knowledge in Portugal. So these exchange programs back and forth, and there's even research projects back and forth. It's actually very cool. And there's also in Georgia. Now you would think, oh my God, they're actually Portuguese here. There are. I did not know this. And so Marisa, who is a very well-known Portuguese fado singer, came to Atlanta. And I was like second year here. I'm like, I gotta go, I gotta go. We went. First row, I gotta go. Sure enough, out of the woodwork, all these Portuguese people just started showing up. And I'm like, what is going on?
Yep.
I actually was more culture shock than anything else. So they're here. We have two restaurants. One just opened down the street from where we are, and another one's in the northern part of the city by the Brazilians. So there are growing communities outside of traditional Portuguese, what you call enclaves. And I'm not going to go into the census piece because, sorry?
No, I said very much so. We see that a lot.
I mean, I'm just always surprised that, like my mother and I, when she comes down, sometimes we go out shopping and we bump into people who speak Portuguese. First of all, we have to like hold ourselves because we're not really sure where we are at that point. But the point is this, is that the Portuguese-Americans are not just located in the Northeast or California. They're actually more diverse than what you think. So I'm not going to go into the statistics, but I think it's important to point out that not everyone shares the same experience as Portuguese Americans. What do I mean by that? When your family has actually emigrated to the US, and also when they came here, where the geography where they settled, and I'm trying to think what would be the third one. I think let's just stick to that. Those two is those are having a great impact on the acculturation and assimilation. So for me, I grew up in Fall River, Massachusetts. My family came here when I was 7 years old. So I grew up in an enclave. I really did. I really didn't know anything different until when I went to college. And I'm like, all of a sudden I saw non-Portuguese for the first time. And it was a Jewish school that I went to. That was a shock in itself. So, but those experiences matter because my mother can actually operate not knowing English, where other communities, you have to sort of acculturate at a faster pace. And the other communities, you have second or third generation. And I've actually had one student whose mother was Portuguese-American from the city of New Bedford that she married this guy and moved down here. And, you know, she's been down here for many, many years. So that matters in how you access healthcare. Because if I'm a second or third generation, I'm going to access healthcare than, let's say, as an immigrant, which is in my case. So I have these two articles, well, one article and one book. Leo Papp, how can I say this? There's been a lot of work done for Portuguese Americans when it comes to looking at the cultural, like the feast, looking at the literature, looking at the language, looking at education, looking at even sociological studies. It's great, or even ethnographical studies. It's great. But there are not many. Actually, when it comes to public health, it's like so small. And I'll tell you how small it is. It's like 30 articles that we found. And then we're going to get a little bit more into that. But the great stuff that's been published is really what fueled part of me why I'm here today. So for example, Francisco here has a wonderful kind of article looking at the autobiographies of Portuguese Americans. And I started reading and I'm like, these are some really interesting books that probably talk about health experiences, but not necessarily published in the academic literature that I have to look into. And Leo Papp is just a classical example that I wanted to point out. One of the articles that I actually shared with Angela is by Francis Rogers. Francis Rogers in 1974 published this interesting article, which kind of spurred why we're actually looking into this, developing this into a paper this fall, is The Portuguese of Southeastern New England, Suggestions for Research. And I read that, I'm like, I'm all excited. I'm like, oh my God, maybe there's a template somewhere. So when I read it, there was actually 4 lines dedicated to health. They had a couple paragraphs on folklore, anthropology, linguistics, history, language, but 4. And honestly, because it was published in 1974, some of it was kind of had some racist overtones because the way they classified Cape Verdeans and even his approach to the Portuguese was a little antiquated. So this is why we're here. You know, we need to start writing our story when it comes to public health, but we also need to understand what's been written and why. So let me go into the next slide. I get really animated, by the way. So you're gonna have to excuse my energy. So the literature in itself was wide open. There was no, parameters on dates. There was no language issues. We didn't care about if it was Portuguese or English. We wanted to look at everything that was published. We spent a lot of time looking at dissertations and master's thesis to really get a better understanding of what was published. But we used keywords, like, for example, I just highlighted just a couple, like Portuguese immigrant, Azorian, Luso-American. We literally used, I think it was about 30 word key search words, and we use them in different combinations to see what we can find. And we specifically only focus on health, medicine, and health access, and anything to do with public health, literally. Now, this is where it gets a little bit dicey. We just didn't want to just limit it to public health, because you can write an article about obesity and not necessarily talk about health issues or even diabetes for that matter. So what we did is we listed all of the key major public health areas to make sure we can capture them. And that was a fun process. I actually have two students work with me, Grayson Gunn and also Rebecca Golden, who are actually are still working with me, and I really appreciate for their time. So let me go into this. Oh, there's also another piece. I'm not going to go into this into detail. I wanted to focus only on the published academic literature. Why? In talking to folks in the community, I would come across interesting kind of not blogs, but like interesting opinion pieces or monographs that weren't really peer reviewed. Let me give you an example. There was one that looked at post-traumatic stress disorder with Portuguese-Americans that fought in the African colonial wars, but really looking at it from the U.S. perspective and how the VA needs to work with that. It wasn't like, it almost became like an opinion piece, and that's not really scientific. So while I'll probably acknowledge that in the paper, that's not something that you need to really hold to, and that's actually been peer reviewed and gone through the scientific process. So let's go on to the next slide. So I'm a visual person in many ways, so I like to give folks an idea of what's been published. So let me just give you some context. The Portuguese have been here since the Civil War, not even a little earlier than that. I think that even the Revolutionary War, if I remember correctly, but they weren't here like in mass numbers. You really saw that in the late 1800s. They've been here for a while. So the Portuguese, in many ways, laid the foundation with the Cape Verdeans for other populations that are coming to the U.S. I mean, that's not unusual when it comes to migration patterns. The thing is this: when did the health literature start being published? So the first one was in 1978 in actually Southern California. California is very large. And it really looked at comparison between Portuguese youth, Mexican-American youth, and I can't think of what the other youth were. I think we're African-American when it comes to educational attainment. So that was the first article. And it was really interesting because it's not what I expected. And the latest article, which is in 2019, was a focus on environmental health, looking at a Superfund in New Bedford, Massachusetts. And I grew up in that area. Didn't even know we had a Superfund in New Bedford. And how families are really looking at child and maternity health issues and the Superfund, and how well are they versed when it comes to issues around environmental toxicities and so forth. So that's the latest article. As you can see, it's quite a gamut. But if you break it down even further, in the 70s, you have two articles, right? Mind you, when it comes to language, when it comes to history, when it comes to ethnographic studies, you have a lot more being published, but nothing around health. So you see some studies in the 80s and the 90s, and I'm not going to go into detail for the rest, but it gives you a sense of, when it comes to a timeline, how they publish. This is what's interesting. And this was hard. And I have to do a really good job, and this is one of the things I was working on this past weekend, is kind of creating the methodology piece of it, and how we actually did the work in locating these articles. Is that just because we have an article, don't get excited that it's all about the Portuguese-Americans. It's not. So I use California as an example. Many of the articles use Portuguese as a good example, but they use it as a subset of a larger sample. So when they actually are in the discussion of it and kind of looking at the health outcomes, they're not really looking at the Portuguese at all. They're just like generically looking at, one ethnic group versus another ethnic group to see if there's anything statistically significant and what might be yielding. And sometimes they group, let's say, the Portuguese with Mexicans or Puerto Ricans. So, but it's not anything that really kind of jumps out at you. There's one study in 1979 that looked at the swine flu, and there was a debacle that we really need to also pay attention to when it comes to swine flu in the late 70s and the vaccine development, similar to what's going on today with COVID, that they rushed the vaccine out and some folks died. And then all of a sudden the public mistrust was there. And then there was a study with folks, I think at Yale, who wanted to look at seniors community centers, and they focused on East Providence, Rhode Island. And if you know anything about East Providence, it's heavily Portuguese populated in many ways. But the way they classified the Portuguese, well, they're Portuguese in one paragraph, but they're really Cape Verdean. So you don't know where you're going with that. So there's a lot of mislabeling in some respects, but there's also a lot of confusion in the population sampling. So, which I actually made a note here, that it makes it hard for kind of looking at generalizability issues. And when it comes to say, these are the issues that really matter to us, because it's hard to say when you're looking at a subsample, but you're not really, yielding any information. So we're about halfway done. Okay, let me see if I missed anything. Which is the next slide. I'm going to talk a little bit more about this is, this was a shock to me. I actually, rethought my process around this and just writing a paper on just mental health. And I want to show you what I mean. So this is kind of another visual representation. If you were to cluster things by almost like association, you would see where the greatest numbers are. So you see mental health here, 13 studies. That's great. Need to let you know, this just because of 13 studies doesn't mean that they're just focused on Portuguese. Very few studies have a Portuguese focus. Maybe 2 or 3 that I remember off the top of my head. You have one on intimate partner violence. You have one on ADHD. Done interestingly, and I'm very, very concerned about this, done with Portuguese families in South Florida. And when I say South Florida, I'm talking Dade County. So me thinking the way I'm thinking, well, is it really Portuguese or maybe it's Brazilian? Like, what's going on here? And if you hear my cat in the background, I apologize. So that's an interesting article, but what does it really mean? That's kind of what I'm asking myself. There's 2 articles looking at substance abuse. Now, I say substance abuse like this. I have to look at the camera. That there's actually drug abuse, or looking at marijuana, which is one of them, and the other one is tobacco. But I grouped them together, and substance misuse has an overlap with mental health. And I put cancer here because it's a close association with tobacco. STDs, it's really HIV. There are 2 studies, 2 studies actually looking at HIV, one specifically gay men, which is an interesting paper, but the other one is not so good, but there's some kernels of information in there. So I'm like, me being who I am, like, let me hold on to it. I don't want to I'm having separation anxiety from the article. It could be used. I'm not sure if it will be used. And then there's this other cluster over here. You see it over here, looking at health access. Not unusual, especially with ethnic groups. They tend to look at health access issues. One focusing on nursing and cultural competency, one looking at the flu, that's the swine flu that I talked about, that article. One, Machado's disease. Actually, see, that's what I expected when I did the lit review. You're going to get like 13 articles on Machado's disease. Not really. And then the other one is workforce safety. And this one article is kind of a ethnographic analysis of Portuguese workers and how upset they became when they changed some rules and regulations within the employment, and how the employers and the employees resolved that issue. It's kind of an ethnographic study, but there's a really interesting points in there thinking about kind of health when it comes to worker safety. Trying to think what else. Now, for any of you who are public health, you would say, well, Carlos, and when you think about public health, public health can be like huge. You could use what is called the social determinants of health that has many different layers, like looking at transportation, housing, look at education, and so forth. The thing is, I really wanted to focus on health because I wanted to know what the conversations were around health. So if I use this, let's say, the social determinants of health, which is what the World Health Organization uses and so forth, as a way to frame kind of larger population health issues, I'm not really capturing the true nature of what's going on. And it also would be misleading. So for me personally, I'm looking at it from an ecological perspective, but I'll really focus on public health. I'm looking at the time I want to be. So who's publishing? So, and this was a surprise. And this is kind of like just eyeballing something without researching, without having contact with the actual authors. Out of the 30, about 14, 14 of them have at least one Portuguese surname. 7 studies from the with a focus on mental health have at least one Portuguese surname. And the others, I just looking at other things. Since 2000, about 11 studies have been published. But that's telling me that there's momentum coming in looking at health and public and the Portuguese-American community. This is the problem. I don't know if this is just the nature of academia, right? Is some folks will do a project based on a dissertation or a thesis, and they will get it published. But there's no one person or one group looking at creating a research portfolio. So what does that really mean? That's workforce development issues, because that's telling me that there's really not a scholar out there really looking at this. So that's a concern of mine. I'm trying to think what else. And I'm going to be a little bit philosophical, but I need to say this. Some people will not like what I have to say. Some people will. It really depends on what your positionality is on this. One of the things I get to ask myself all the time is, who gets to write our narrative? When you're looking at the history, and Denise, you know a lot more than I do about this stuff. I mean, when you're looking at our history and our language, when folks who are not necessarily part of, I always sometimes question whether or not are they getting the nuances, the cultural nuances of the community. And what does this really mean? Not to say someone who's not should not do it. I think we need to ask the question at a larger level, as an ethical question, is who's writing our narrative? And those who are writing our narrative, can they stigmatize us further? And we're going to talk more about that. I'm trying to think what else. Like one of the things that I should point out is that when it comes to the 30 studies, is they didn't really distill between immigrant and non-immigrant. They didn't look at, some studies did a good job looking at first generation, second generation, many others didn't. So you really don't get a whole flavor for what's really going on. And then I mentioned the Cape Verdean and the Portuguese confusion piece of it. And then also when you're thinking about Portuguese, who gets to be Portuguese? Is it continental Portuguese, those from the mainland Europe? Is it the Azorians, or is it those from Madeira? And a lot of that is not necessarily discussed. What I found interesting, some studies made it almost like a footnote. Out of a sample size of, let's say, 20 Portuguese Americans, 5 were Azorians. And they maybe highlighted one little thing about that. But they really didn't talk about sort of the nuances of what that means. So, and I want to spend a little time on this, because I think it's important, like in an era when we have a heightened awareness of, let's say, ethnic studies, one could misrepresent a population and perpetuate stigma and also misinformation. I say this because I had an aha moment maybe 15 years ago. I did some work with Dr. Satcher. If you don't know who Dr. Satcher is, he's like a rock star. He's a former director of CDC, and he's also the former Surgeon General. He lives here in Atlanta. He actually works at Morehouse School of Medicine. He actually created the Satcher Center, which does amazing work, and he was a leader when it comes to looking at mental health in the country, and also a leader looking at HIV. He said something to me that really made me stop dead in my tracks. No one ever said this to me. He said, Carlos, did you ever think about if we just publish on one topic on the population, that perpetuates stigma and misrepresentation of the community? Me being me, I'm like, what do you mean? How? And he used sickle cell and African Americans as an example. But what I'm going to use today is looking at bi and, let's say, gay men. When you do a literature search and you look at the literature that's been published around HIV studies or STDs, you get like a ton. I'm talking about a couple 100,000 hits. While it's important to focus on HIV, that's not the only thing affecting gay and bisexual men. But you also need to ask yourself this question. As someone who's doing public health research as a novice, or even a little bit more nuanced, or someone outside of the community, and you do a Google search, or I shouldn't say Google search, but really, let's say the easiest one would be a Google Scholar one. The impressions you get of the community can be skewed about what you think about the community. And that's really powerful, because it makes us stop and say, should we publish this? And I'm going to give one little example, because I get excited about this. I have been sitting on I did a transgender health access project. I have been sitting on this data for like 3 years, refused to publish it. And then I'm in the final stages of getting this bisexual article on program evaluation done. And I attended a virtual webinar on transgender health issues. And I realized that's the person I need to work with. So I'm working with someone from Northwestern right now, because I'm not transgender. I'm not going to pretend to be transgender. So for me to approach that, I don't want to just write about something that actually further stigmatizes the community and misrepresents the community. And when I submitted my bisexual paper with them, they made sure it was like went through fine comb, like it was. They made sure that the paper was truly reflective of the true state of bisexual health in the U.S. Because they were curious. Not only that, but they also wanted to make sure that they weren't perpetuating stigmas or misrepresentation. So I think I'm almost done. 2 more slides, 3 actually, and then we're going to end it. So these are some highlights when it comes to the health data that came from the literature review. I highlighted this because I said, this is really interesting. It kind of talks about many dichotomies, but it also, to me as a public health person, it's nothing new. There really is nothing new in some respects. So the ADHD article that I mentioned with the Portuguese in South Florida, it was really about how do you talk to Portuguese-American or Portuguese-speaking parents who have children with ADHD, and how, issues around community services and school issues and so forth. So this is some of the information that they actually recommended after the study. Lack of knowledge, resources are an issue, and lack of information provided by professionals. Okay. I mean, there's nothing new there. I mean, when you're thinking about certain ethnic communities and the more localized that they are around language needs and so forth, that's what you're going to get more or less. The question is, what does it really mean for the future? And there's also this issue around medical mistrust. So the flu issue, I explained around the swine issue, how there was a debacle, the vaccine, and they wanted to test it out with seniors in East Providence. There's this tension between medical mistrust. And there's one article on cancer, if you remember. Let me get my Diet Coke for a second there. And there was an Azorian woman, and they quoted her. It was a qualitative study looking at what the participants' perceptions and beliefs, that she mistrusted the medical system because she believed medical doctors were getting her husband sicker because he had cancer. And I'm thinking, oh my God, that's a huge missed opportunity. What does that really mean? So that's another one. And also, this is also not new when it comes to immigrant health issues, that there's an interplay between, let's say, barriers to healthcare, like satisfaction and barriers. Some really liked, some didn't like. There are organizations like the Cambridge Health Alliance that's doing really good work. So there's a lot of satisfaction in some places, but other places, and we need to explain why that's the case. Is it really the environmental? Is it really the surrounding of why there are barriers for the population? Also, the desire for Portuguese-speaking clinical staff. I came here when I was 7 years old. I still translate for my mother. My brother inherited that little throne, as much as he likes it or doesn't like it, and we play a role in that. And and that's just what we do. But it's how my mother, my stepdad, how my aunts, how my uncles, how they facilitate health access is really predicated on, does someone speak Portuguese? I mean, think about the options. You're in a foreign country, and all of a sudden, I need to find someone who only speaks English, and I am in Ukraine. Okay, that's going to be limiting in some respects. There could be bilingual folks there, but not necessarily the case. Also, health communication. When it comes to marketing and information, let me just say this, and I'm going to be very quick. Sometimes folks use Spanish to supplant the Portuguese information, but some places like Massachusetts, Rhode Island, I'm not sure about California. I know Florida struggles with some of this, is that they're looking at developing it only into Portuguese. So this is other things. I think this is more interesting because this kind of speaks to second generation and third generation about their connection to their own identity. When I'm talking about the ethnic identity, is mental health clients with high ethnic identity are more satisfied with therapy sessions. Let's say then clients who have a low identity with their when it comes to their ethnic identity. So what this is really saying is that we need to be looking at more culturally inclusive care. There's a hidden message here. If you are, let's say, I'm going to use as a quick example. If you are Portuguese speaking and you need a psychiatrist, and let's say you have schizophrenia or, major depression, finding someone who can prescribe to you the necessary medications, there are not that many professionals. And what I recall, and I still have conversations with folks in Massachusetts, there's not like a lot of them out there that you can go to. So there's a problem there. And I think it's more around sort of workforce development issues. The second one, or the last one I should say, is looking at second generation Portuguese-Americans have more favorable attitudes towards seeking professional psychological help versus first generation. I mean, that is, I think that's part of the acculturation piece of it. I don't want to belabor that, but I think that's important. I have a couple notes here. So some of the things that we need to be looking at when it comes to mental health is like best practices from other ethnic groups. Like, this is not like the Portuguese should not be asking ourselves, oh my God, there's nothing for us, so therefore we are doomed. No. What we should be asking ourselves is what's been done in other areas and other ethnic groups that can be culturally transferred and adapted to our population. That's what we should be asking. And we also should be asking ourselves, how do we increase mental health utilization rates? How do we, none of the articles look at overdose, suicide prevention, Medicaid adherence, or even depression. None of them. Okay, none of them. And that's a huge problem. And I'm not going to tell you a story about that. A lot of them looked at the Portuguese and narrowed it down to Portuguese, but not necessarily looking at gender issues. So what does that really mean? Just because you say Portuguese, how generalizable is that? And then, but there are also beacons of light that we need to acknowledge. The Cambridge Health Alliance in Cambridge, Massachusetts has been doing wonderful work. You know what I mean? They could be a model. We just really need to start engaging to looking at best practices. Okay, I was supposed to drink Diet Coke. Okay, we need to talk about challenges. We need to talk about what does this mean for the future? And the next slide is really, I'm going to read a couple questions, but I really want to hear from you all. So why are we here? Why do we have some challenges? Let me just start off with, in public health or even medical research, we are slaves to how the federal government identifies public health priorities. Like right now, no one was focused on COVID. All of a sudden COVID came on and literally our school was like, okay, every proposal needs to have a COVID, kind of like looking at it. And what does this really mean? Should we maximize it looking at different ways of looking at our research studies or even our future research studies to incorporate COVID? I was doing that this morning on another webinar and trying to collaborate with some folks because I was telling Angela, I'm doing a COVID study looking at how partisan politics looks at public health mitigation when it comes to safety measures for COVID. So I'm kind of playing the rat race in some respects. The problem is with this, the funding sources dictate the priorities, but the priorities also rely on the Office of Budget and Management on ethnic and racial categories. The Portuguese are part of the white population, so guess what? We just get included in that sometimes. And if you look at some other articles that I have for the LGBT, the Portuguese-speaking populations compared and actually wrapped into the Latino population. So it's really kind of depending on what you're looking at. That's an issue because that's telling me no data, no issue. What else? So this is kind of a, how can I say this? I'm not a doomsday kind of person. I always like to look at sort of like how do you make, lemonade out of lemons and whatever the case is, or make, have lemons and make their lemonade, whatever the expression is in English. But the important thing is that if you look at public health and how we do our work, there are interventions that are culturally adapted. Like for instance, the National the National Cancer Institute. I attended many years ago. I was doing a lot of NIH work and I would go to their national meetings. I almost fell off my chair to see, it was quite beautiful, that there were cancer prevention programs and strategies, Filipinos, Japanese. I'm looking around thinking, wow, this is interesting. I mean, it was just, the breadth of it was really deep when it comes to cultural awareness. We need to start thinking about how do we develop culturally tailored interventions, but we need to stop because we need to also acknowledge the community. So when I talk to folks at MAPS, Immigrants Assistance Center out of Massachusetts, I emailed the folks from California. I haven't got a chance to speak to them yet. I think they focus more on substance abuse. And there's a couple other agencies that I've looked into. Is guess what they're doing? They're doing the good work. They're doing what makes sense for them. How do we take those, what we call homegrown interventions, and scale them up to be best practices? I'm also doing this with a dementia project, actually with Harry out of Texas. With Portugal, in northern Portugal, we're looking at developing a mobile technology for folks who have dementia and also eventually bringing it to the US. So that's one thing we're doing. Workforce development, I talked about CBOs. What else? I'm going to be very, very quick because I want to be sure. I talked about the data. No data or limited data, there is no issue. There is no issue. You can look at Ludlow, Massachusetts, has a strong Portuguese community. You can even look to a certain extent, Lowell, Massachusetts. Public health departments are collecting data, per se, for the Portuguese, for the Caverdians or the Brazilians. There's been some strides in Framingham for the Brazilians, but what's happened is that community assessments are being done by hospitals, which they are mandated to do. And then they include some generic information for the Portuguese. And the problem is this, they do focus groups and they get this weird kind of like constellation of ideas of what the population needs. So it's not really as in depth as I like it to be. So I think this is the last slide. And
when you say no issue, Carlos, are you meaning like because there's no data, there's no Portuguese are at higher risk for heart disease or Portuguese are at higher risk for diabetes? So they're like, according to the data, Portuguese are healthy. They're not at risk for anything. Is that kind of what you mean? I don't know.
Yeah, that's what I mean. I'm trying to go fast. I apologize.
Yeah, no problem.
It's a really sad situation because when you write a grant, you have to do a statement of need. And if you don't have data, how the heck are you going to say this is an issue? How do we know that diabetes is not an issue? How do we know substance abuse is not an issue? Let me just, from my own personal experience, when I was growing up as a kid in Fall River, substance abuse, intimate partner violence, drug abuse later on are issues that we deal with that as quietly as a community. Mm-hmm. But guess what? The data is not really there because we're not really looking to capture the data. So therefore, it doesn't exist. Mm-hmm. You know, when the opiate crisis was hitting before COVID, I would monitor the Herald News and the Standard Times out of New Bedford and Fall River to see the deaths. Just to look, you know, I sound like I'm like retired in South Florida somewhere looking at the obituaries to see who's dying. But I would look at the deaths because I would want to see whether or not who's dying. Because I would anecdotally hear from friends that people would die in the 30s or 20s of drug overdoses, but they get classified, you know, as an overdose, but they're not getting, when it comes to the autopsy, but we're not capturing the data here by the Portuguese. And there's another issue, as I tell my students in my class, just because you die of an overdose, you can have your autopsy sealed. So therefore, you don't really know the true nature of the disease. I'm not going to go into that. But so there are problems we need to deal with. Like, for example, one of the things I admire about PALCUS that I've watched from afar is this national effort to have the Portuguese count, which I think is wonderful. But I also have to ask myself, if we're dying and we don't know why we're dying, I don't know. Like, what does this all mean? And I also have to ask myself, and I told this to Frank Souza. Frank Souza was my first champion in this. I told this to Frank Souza out of UMass Lowell, out of the Center for Portuguese Studies there. If we're dying, what's the point of trying to keep the language alive, the culture alive? What's the point? If we don't know why we're dying, I mean, how do we get healthier? How do we know that, you know, our diet is really what our issue is? And you know, I've talked to other folks about this. Another one's on SU Almeida, who's really, really been a wonderful a resource to really start thinking about our health matters. And I want to tell you what's messed up. I want to tell you from a Fall River, you know, talking perspective. You know what's messed up? Before COVID, I was just happy doing my public health work. I'm just happy doing my thing. All of a sudden, COVID hit. I wasn't surprised we're going to have a pandemic. I always knew we're going to have some sort of pandemic. What surprised me and it shocked me Every time I turn on the news, and I have a TV there, that's why I'm looking over there, everything is focused almost on public health. For the first time ever, I can talk to people about public health. Before, I'll be like, I would shy away from it. I would like not talk about it. I would avoid people. But for the first time, I don't know if this is good or bad, we have an opportunity to do something because of a tragedy. The question is, how do we want to move forward? So I'm going to stop here because I talk too much.
No problem.
As my husband would say, enough is enough.
Well, we do. I feel, yeah, no, I feel like we do have a couple of questions, and I feel like we need to have a follow-up session to this because there's so many questions and talking points that we can explore. But one question that did come in asks, has assimilation rate or geographic location surfaced any trends related to the social determinants of health? And I'd like to add on to that first, is there, in your estimation of the amount of data or lack of data, is that even enough to identify a trend? There was one data point you had about, second generation Portuguese-Americans are more responsive to mental therapy, that kind of thing. But that was, I think, one study or something like that. Right. So what about, to the original question, assimilation rate or geographic location? Does that make a difference in our health? So
for this paper, we're only going to focus on the 30 articles. And whenever you write a paper, there's also limitations. And there's also a section for future directions of how you want to look into what folks should be looking into. The acknowledgement is that we don't have much, but we can make some sense of something and get a generic idea of what it is. But it's really not the full picture. The thing is this, we have to start somewhere. I mean, it has to get written somewhere or start somewhere, because if we don't, then how are we going to do this? Because this can be a platform, like I actually talked to Paul Pinto and Elena, I always go by Elena Marks, but I know she's remarried. We talked about this. You can use these articles in your statement of need for your grants to say, this is the problem. This is why we're not answering the statement of need the way you want it, because we've got a problem. But based on local ways of looking at the health needs, this is how we're going to get a community grant. So it's really empowering the community in a different way. Now, you started talking about social determinants of health. What was that again? The question was, has assimilation rate or geographic location surfaced any trends related to the social determinants of health? Okay, so let's talk about assimilation rates first. I know both of you in California, so let me just break the news. The majority of the studies have been done in New England. Very little has been done in California. And I think that's a question we need to ask why, which I find interesting. And there's a reason for that, because obviously the population is in the most of it, let's say, is in New England. But assimilation rates do have an impact, because we need to think deeply about first generation, second generation, immigrants, non-immigrants, immigrant speaking, and the studies are not doing that. So that does have an impact, because if you're an immigrant, you do have certain barriers that, let's say, a second generation person does not. So if I didn't cover that in depth, but earlier, I apologize. But we need to start looking at studies and looking at, let's say, at the Portuguese and segment it, literally immigrant, non-immigrant, Azorean, Madeiran, continental Portuguese, looking at second generation, third generation, and really trying to understand, based on whatever public health topic, what's going on with any of them, and to see if there's anything that's clinically significant, statistically significant, to say, what can we learn from that? That's one way to do it. Another way to do it is let's say, a qualitative study, but it still takes money, is looking at from different segments of the Portuguese population or Portuguese-American population and asking them more in-depth questions to really understand how assimilation impacts their lived experiences. So I'm hoping I'm answering your question. I can't see the question, so I'm going to have to rely on you.
No, I think you've answered, because in the aspect that assimilation, as you mentioned, does have a lot to do with it. And I think that's one of the reasons why you mentioned California versus the East Coast. California being, as you mentioned right at the top, a giant state, and we're kind of all over. It's not like we're just in San Jose or we're just in Los Angeles. We're kind of all over. And then in the rural communities, and even in the 1960s, San Jose area was not the metropolitan area that it is today when the immigrants arrived. So people tended to assimilate a lot more than they did because, as you mentioned, Carlos, you could have functioned, or your mom functioned very well in acquiring all the services that she needed in Fall River, Massachusetts, because of the high population of Portuguese, and you or your brother or someone in the family would go along and translate. And I'm sure, outside of health and everything from a bank to a baker, she found someone who could speak Portuguese. And so that happened in certain areas of California, but very, very, very few of them. So people had to assimilate, and people, and so that's, it would be a total different study, I think, here. Yeah, indeed.
Mm-hmm. Yeah. Mm-hmm. It's sad. Go ahead. I'm sorry, Angela.
No, I was just going to say, so, given just the few minutes we have left, and for those that are, for those that are watching and that will watch this later on, what would be, your message to the community? And is there any sort of action or advocacy that can be done? How do we help this effort? If there are people who are interested in working with you, or I'm thinking of one person in particular who really wants to get involved doing public health research, but she's not quite sure how to go about doing that, I guess, because it's not an area that she currently works in. How could somebody perhaps work with you or help and get involved in this effort?
So the cliff notes of that is there's my email. Please reach out to me and let me know that they were part of the webinar. Sometimes things get into my spam folder. I actually, in planning for this, I had a conversation with Angela. I think she probably needed therapy after we talked, because I just unloaded a lot on her. One of the concerns that I have is they're not really, there's some Brazilian scholars doing the work, like 1, 2. There's a Portuguese guy in Miami, but he doesn't do Portuguese health disparities. There's a couple of folks who are doing work in different places. There's one in Pennsylvania, I think it was. No, upstate New York. There are folks who are doing it. And then there are also community partners who are doing the work. So one of the things I floated to Angela, and this is a rough idea. I spoke to also a student who wants to get her doctorate in public health, who's a Portuguese-American, who I know through a family friend, and I want to be working with her, is how do we start working together? How do we start networking together? How do we start working to best practices? Mm-hmm. Why should this be housed in just on my computer? And by the way, this is how entrenched I am in social justice. A lot of, actually, the articles, all the stuff eventually is going to go to UMass Dartmouth and their archives, just because it has to be there for some future generation. What I would say is this, Angela and I are going to be talking is develop and I'm going to screw this up and I have to forgive me, develop a national organization, very loosey-goosey, kind of like as a networking for folks who are interested in Luso-Brazilian health disparities. And I say Luso-Brazilian because we can learn from the Brazilians and Cape Verdeans, because there's a woman out of Simmons College who's been doing some amazing work around Cape Verdeans. There's a woman who's out of American University who's doing some amazing, or has done some amazing work with Cape Verdeans. We need to start working together. Mm-hmm. We need to start figuring out how to collaborate. And not just, I'm not talking about my professional growth. This is my 3rd career change. I'm talking about how do we change the paradigm in our community. We do a really good job making money, saving money, getting wealthy, businesses, whatever. We are very entrepreneurial in many different ways. And that's a good thing. But that doesn't mean we understand how we're living when it comes to our health. Mm-hmm, mm-hmm. And I think we need to have those conversations. And I actually had a conversation with a friend of mine, Fernanda De Souza, out of the Department of Public Health in Boston. And her and I used to work together in Fall River together as community organizers. And unbeknownst to me, this is how sick this is. And it bothers me today. She developed one of the most effective programs on healthy eating with senior Portuguese-American women who had a 2nd grade education. And basically, her program changed the lives of these women and how to cook healthier. Where is this? Where's this stuff? I know it because
we all need that, not just senior women.
How do we take that, like that here, and how do we share it? Let's say with newcomers. How do we share it? Like there's a huge Angolan population in the Houston area. Why should it be alone? There's Brazilians here, and I actually was talking to the Board of Health here about the Brazilians here. They're struggling to try to figure out what to do with the Brazilians. So I feel like we don't need to recreate the wheel. We need to figure out how to share resources. I don't know how to do it. So Angela, we're going to have conversation. And if folks are interested, I have no ego on this. My ambition is let's get the work done. Mm-hmm. Is if folks are interested in working on this, by all means, just email me, or I don't know if Angela has it. They have your email address. They can email you. Yeah. Did I say too much?
No, that was great. I mean, the whole part of getting that started is putting the word out there to see who's interested and who wants to be involved, right? Because it requires people that have the desire to make a change. Like we might have a good idea, but if it's just the two of us or the three of us, that doesn't work, right? Sure. And you can't force people. So I think that's a great place to end it and to say to be continued, because I think obviously there's a lot more work to be done, but this starts the conversation and makes people aware that we need to be counted, and we need to have our data. We need to have data on our community so that we can make better decisions about our health and have better resources and all that kind of stuff. So thank you for your research, and thank you for doing that.
Thank you.
We'll have, we'll talk again about doing another one of these. And, even if it's more of just a discussion, maybe we bring some people together and have a conversation about how to move forward. But it's a great starting off point, and we look forward to hearing from those out there who want to get involved.
Can I just say one little thing? I've had conversations with our counterparts in Canada, with the Luso-Canadians.
Yeah.
They're struggling like we are.
Oh, yeah?
They are. So, I mean, if we do something like this, I really want to, it could be a really true North American endeavor, because I got to say, Canada, Toronto is doing some amazing work when it comes to this. And I think we need to learn some of them. Like there's a woman out of British Columbia or Alberta, whose only focus as a Portuguese researcher is on domestic violence. I can't use her data, or not use her data. I can't use her article. But why can't we learn from her?
Yeah,
exactly. It doesn't make sense to me. It just doesn't make sense to me. So,
that's a great example. No, it's great it makes a lot of sense. Again, lots of work to be done, lots of conversations to be had, but unfortunately we do have to wrap it up. But thank you so much, Carlos. This is really great. And I hope that everybody that was watching out there, it kind of gets us all thinking and spurs us to take action in some regard in this area. So with that, we'll just say thanks, everybody, and until next time.
Thank you.
Thank you for your time.
Thank you, Carlos. Thank you so much. Appreciate it. Bye-bye. Bye-bye. Take care. Thank you.
Thank you.
Thank you all.